Good morning, everybody. Welcome to the September IP call. We are going to record this session today, so those that are not with us can come back and watch it at a later date. Just a reminder to please mute your lines. I am going to try to leave all lines unmuted during the call so people can speak up and ask questions throughout the call. Please be sure to mute on your end. Do not place us on hold, otherwise we'll hear your hold music from your system. So again, welcome. Today we're going to talk about Diff reporting and antimicrobial stewardship. We're just doing our part one of this community of practice, just really getting started with this topic. So I'm going to go ahead right away and hand it off to Nancy Wild, and she is going to talk about CDI reporting. Nancy, are you on the call?
I am. Can you hear me?
I can.
Great. Okay. I'm going to try to go through these slides pretty quick because I really want to allow for some time for some discussion. So, and Jennifer, I think it's probably going to work best if we just use the slides I sent you and just let you forward through those.
Yep. Just holler at me when you're ready to switch.
Okay. We'll go on next. So really what I want to do today, I know that most of you are already reporting on C. diff and MRSA bacteremia, but just wanted to kind of review what the reporting plans would look like, how you report for both of those, and then really want to start out with the impact of antibiotic stewardship on CDI rates, because that's going to be someplace that we're going to go a little bit further with this after in further phone calls and webinars. So if you could go ahead and go to the next slide. I put this picture in there because this is a huge reason for what we're doing today. And this slide reflects where Iowa is at and on a national level with antibiotic prescribing, and this is for all prescribers. And we see here that 50% of all antibiotics prescribed at the provider level office are either unnecessary or they're inappropriate. That's not new information. But what is concerning to me is that Iowa is in that group that is the second highest user of antibiotics in the country. So I think this is something we need to be paying attention to. And that leads right into the next slide, which shows us where we rank as far as hospitals having fully implemented antibiotic stewardship programs. And this is based on 2014 data, so this is old, and I think that we've done better. But at that point, we were at 18.6% of our hospitals had fully implemented antibiotic stewardship. And I know that a lot of you have started and are doing things, and even in this, it doesn't reflect those of you that have already started and had some really good processes in place, but this was those that had fully implemented programs. And I am going to do some additional, we should be getting some additional updates based on 2015 data, so I would expect this number to improve. But you can see that we're in the group of states that really have the least, and we're in that 7 to 28% of our hospitals that have stewardship programs. So that's really not where we want to be. We'd really like to see that improve. So going on to the next. Just real quick, and I'm going to slide through these real quick, Jennifer, so we can just go. This is, you all know by now that you all have to have a monthly reporting plan added each month. So next slide. And this is for those of you that are either aren't reporting or still wanting or still in the process of setting this up. Really, one of the first things that you should be looking at for C. diff, you want the facility-wide LabID event reporting, your emergency department, and if you do happen to have an OBS unit, you would want to be including that too. It's not showing on this slide, but also if you have an inpatient rehab facility, that's going to, you would want to add that onto this reporting, and I have another slide that will talk about that. So, And then the next slide will show you just the same thing with the MRSA bloodstream infection. As I'm out and about, one of the things that I do see at some facilities is that instead of the blood specimens only, some of you are trying to report all LabID events for MRSA, and that's okay if that's what you choose to do, but what most places are doing are the blood specimens only, which would alleviate some of the burden in reporting, since this would require you to report all positive MRSA results regardless of whether or not they were hospital acquired or community acquired if they're in your facility. So the next slide. One of the things that surprisingly still twists people up is how do you actually put the numbers in for the denominators. So if you're doing this the way that you're supposed to be doing it, the facility-wide in, you're going to have your total patient days, your total admissions, and then you would have your MDRO days and your C. diff days. And the C. diff days and the MDRO days, they both take out your inpatient rehab facility because you're going to report those separate. And then for the C. diff, you would be taking out your newborn babies because we don't do C. diff surveillance on newborns. So going ahead to the next. And I've shown this slide before, but this is just an example of how those numbers would look. So you can see there that your CDI days are different than your total facility days because we've subtracted babies out. So the next slide. So this is the slide I told you that I had in here for the inpatient rehab. I know that some of you do have units in your facility, so those are also required to report MRSA blood bacteremias and C. diff LabID events. And that's regardless of whether it's a freestanding facility that you're responsible for or if it's a unit in your hospital. So going on to the next. Can you go ahead and switch slides, Jennifer? Thank you. So reporting a LabID event. This is where you're going to be reporting all positive tests regarding that are located on your inpatient unit, and that then also if you have emergency room and observation units that you would also report those events. So your facility-wide in is going to include all your bedded patients on your med-surg units. That is going to include observation beds, swing beds, those types of things. So if they're in one of those or in one of those classifications, they would still be included in your facility-wide in. If it's collected in the emergency room or in the OBS unit, assigned to that unit regardless of whether or not they're admitted to the hospital. And one of the things that I have seen on occasion is, and I'll show you this, I actually have a slide that shows you this, but under the event type, you're going to select LabID event, not GI, which is kind of confusing at times. But if you choose GI, then it doesn't report under your LabID and you won't be able to find that. So make sure that you choose the LabID event as your event type. And then the organism would either be your C. diff or your MRSA. So going to the next slide will actually show you how that works. And that's just adding an event. So the next slide. This is where you would choose your MDRO event, your LabID event, and then your specific organism type would be your C. diff or your MRSA. So you can go to the next slide. Well, that didn't help much. I have duplicate slides there, so go ahead and go next. So this is showing the C. diff there for the digestive system, the stool specimen, and then where it needs to be. Those, has the patient been discharged from your facility in the past 4 weeks is a required field. And has the patient been discharged from another facility in 4 weeks is a required field. And if you say yes, then it's going to ask you the level of care that's being provided at that facility, whether it's a long-term care facility, if they were another hospital or whatever. The documented evidence of previous infection is not a field that you enter. If you have entered a person in there and they pick up that it's been a positive test based on your medical record number, it searches for that, then that automatically populates into it to respond to that. So going on to the next. So here again is where it asks you the level of facility. Just wanted to show you there that that is an option to select a nursing home. I hear an awful lot of times that some of you are getting patients in from nursing homes, long-term care facilities in your unit, and that's where you're going to record that. So let's go on to the next. This slide here is, well, shows that whether or not it's an inpatient. So if it's located on your inpatient unit, whether it's an observation or swing, it's going to be a yes for that. Basically, the point there is that if they're in a bedded unit, they're considered an inpatient for NHSN. And I do see a question here that is asked if there's a minimum number of occurrences that are required for reporting, and the answer to that is no. Now, for critical access, it's not required. We are asking and encouraging all hospitals to report on C. diff, but it's not a requirement, but we are encouraging that reporting. So it's not based on a minimum number, but it is something that we are asking all facilities to do. There's another question here for the LabID event. If I'm understanding this question, it has the numbers that are reported. Jennifer, can you go back to that slide for the that shows the denominator information? LabID. Yeah, right in there. It says, does the LabID event number for C. diff include the total number of positive C. diff? Oh. If you're asking as far as the, I guess I'm not sure of the question that's posted. It says, is the LabID event number for C. diff include the total number of positive C. diff that are a hospital onset added to the total number of community onset? And I believe if you're talking about that being for report, then Jennifer, I'm going to have you go back because I think I can clarify that with the next couple of slides. And if I'm misinterpreting your question, Nancy, just go ahead and clarify it for me. So let's go ahead and go again here. And the next one? Okay. I did want to stress, and I put this in here, so before I answer this question, I just wanted to show you real quick. For LabID event reporting, if it is if you get a positive isolate, you can look at these algorithms and give you an idea of whether or not you need to be reporting it. Because if it's on the same unit and the same patient within the last 2 weeks, it's a duplicate event. If it is a new, then it goes ahead and you would go ahead and enter that in as a unique MRSA bloodstream infection or bacteremia or C. diff event. So go ahead to the next. Just a reminder here that C. diff testing should only be done on unformed stool specimens. If it isn't conforming to the shape of the container, it shouldn't be sent. And there again, if it's the first specimen within 14 days of that patient, for that patient on that same location, it gets reported. So go ahead to the next. And I did want to talk a little bit about how those are categorized, and I think this will answer that last question. There's 3 different categories essentially for that NHSN will put your reported event. So there is a community onset, a healthcare facility onset, or a community onset healthcare facility associated. So for the community onset, it is essentially those patients that have a positive specimen within the first 3 days of an overnight stay. Your healthcare facility onset would be collected with after those first 3 days, so day 4 or after. And then the community onset healthcare facility associated would be if that patient was discharged from your facility within 4 weeks prior to that, but the testing itself was done in the first 3 days of that given stay. So if somebody goes home from your hospital, comes back in 2 weeks, and has a positive test, then that would be a community onset healthcare facility associated. So let's go on to the next, because I actually have a couple of pictures of how those reports are written and show up. This is where you're going to find the reports to run. And you can run a SERV report or a rate table. For most of you, the best information or the most information that you're going to get is actually for a rate table. Although for those of you that are in PPS hospitals, I'm going to ask you forgiveness because I'm not going to show the SIR on this. I think most of you are really know how to find that and how to run that, so I didn't do this. So what I'm showing today is mostly the rate tables, so go ahead and go to the next. And this is an example of one of the pieces of information. When you run a rate table for your hospital, you get a variety of reports that are all in one report. The first one is your inpatient admission prevalence rate. So this is how many patients come into your facility over the number of admits, and they already have C. diff at the time of, or MRSA at the time of the admission to your facility. In this case, this slide is for C. diff. So it gives you an overall prevalence rate. So the next slide is the how many of those are actually inpatient C. diff overall prevalence rate. So this, and these are different facilities, so the numbers are going to show different, but this would be the total number of patients in your facility, both healthcare onset and community onset that were in your unit for, or on your, in your facility for each quarter. The next one. So these are the community onset admission prevalence rate. So you can see that with this facility, those numbers are pretty high, but these are all people that have came in with that organism. So the next slide. And these are the facility onset rate. So this is the rate that most of us are looking for. And I'm going to let Jennifer address the question as to how that's reported out for the Hinn and the reports that they're sending out. But I want you to be able to see that you can get each one of those reports for your facility just by running one report. It gives you all of those tables for your facility. So I think that's about to the end of my slides. Do you want to see if there's another one on there, Jennifer? Oh, just my little ploy is my last slide here. Every time I go out to a facility to work with people, most of you are really picking up on how much the alerts can help you. But if you would go in and select that 13 missing summary items, it's going to take you right where you need to be to enter all of that data, and it just makes it so much easier. So when you go in, I encourage you to go in and look at your alerts and respond to those that are missing ahead of time. So I think that'll go ahead and wind up this, and then I'll just allow for questions. Did I answer your question, Nancy, or do you still have? If you, I think that's all the questions that are typed in. Go ahead.
Yes, Nancy, I think I'm understanding a little better. I'm not reporting C. diff yet because I was still confused. So basically you're saying when we report all of our positive C. diffs, when we enter that information, NHSN pulls that out and divides it up if it's, and labels it for us.
That's correct, and that creates a lot of confusion. So I'm actually really glad you brought that up, because a lot of people that haven't been reporting are concerned on how this all reflects. So when you go in to run something, you can tell based on that, and NHSN divides it up based on the information that you're putting in. So you're giving them the date of your admission, you're giving them the date of the test that's done, and where they were, and if they had been discharged from your facility. So it uses those pieces of information to define the category that it's going to put it into. If it's after that 4 days, it's going to be a facility onset. If it's within those first 3 days, it's either going to be a community onset or community onset facility acquired or facility associated. So it does clarify that. So if you do have a lot of cases that are coming in from long-term care, you can divide that out and really look to see what's happening and what your patient population is seeing, and also what's going on in your community. So it's a good piece of information to have.
Okay, thank you very much.
You're welcome. Anybody else have any questions, or should we just move on? Well, that's all the slides that I have, but have any of you been having any problems with reporting into NHSN, or any concerns reporting for the MRSA or the C. diff? Okay, I'll turn this back over to Jennifer.
Thank you, Nancy. To address the question that you had about Hinn reporting. So for Hinn, what we've been looking at, your reports show overall prevalence, C. diff, which is what we've been collecting for the Hinn. For Hinn, we will be looking at overall prevalence for one measure, but we will also add in another measure that we're going to pull and populate that will be just hospital-acquired C. diff. So you'll have two C. diff measures to look at, one overall prevalence, and the other will be hospital-acquired, so you can compare those across to each other. So we'll move on to the Hinn 2.0 update. As many of you know, Hinn 2.0 is wrapping up. It ends here in the next couple weeks, the end of this month. We do ask that everybody continue reporting in preparation for the Hinn contract if we are awarded. Whether we are awarded or not, we are going to move forward with the work. We're going to continue the work that we have been doing for the last several years. So please continue to report your NHSN data, COD, ECLABSI, C. diff, SSI, and VAE. Again, I encourage you to hop on the Hinn Hub. There's the link there, but I can send that out to everybody again. Just kind of a question for the group. We can put together groups on the Hinn Hub, private groups or open groups, but would there be interest from those of you that are on the call to put together an IP group on the Hinn Hub? If you haven't been on the Hinn Hub, we have our open forum, but then we also have a community of practice, a Falls community of practice group. They have discussions on there. They share resources, post questions. So I know several of our IP groups, our district groups around the state, have their own separate email groups or listserv that they email questions out to, just maybe to their district. This would be another avenue for you to use for some of those questions to reach out to everybody that's within the Hinn Hub. So we currently have over 300 users. We're expanding that to include hospitals from South Dakota, hospitals from Kansas, possibly other hospitals, other Hinns, inviting them in as well. So it would not just necessarily be our Iowa hospital IP group. There may be some national resources that jump in there, other hospitals from across the nation. So I can put together the group, and you guys, I'll invite IPs that are currently in there and then I'll leave it open so others can take a look at it, and you can jump on if you feel like that might be beneficial. It is just another avenue for reaching out and networking to other IPs across the state or across the U.S. I talked a little bit last month about the run chart enhancements. We now also have CEO dashboards available on the Hinn database. The run charts and the CEO dashboards, run them in very similar areas. They're customizable, so you can choose your category, the measures you want to include, the months that you may want to include. For your run charts, you can change the report format, so you can download it as a PDF. So you would see these run charts, and this is what you would show if you run it as a PDF. If you run it, you also have the ability to run in Excel format, so then that will pull those run charts. It will just pull the data into an Excel file. Last Friday on our Hinn Hub Zoom office hours, which we hold every week, we did go over the run charts and the CEO dashboards. We will be doing that again in October for any other hospitals that may be hopping on and would like to know some more about that. We do post those on the Hinn Hub, so you can see what the topics are going to be for that week. Other Hinn updates, so the tentative announcement for the Hinn is September 30th, so that's coming up next Friday, just around the corner. New baselines will be reset to 2014 for all of our Hinn measures. You recall with Hinn 1.0 and Hinn 2.0, the aims were a 40% reduction in healthcare-acquired conditions and a 20% reduction in readmissions. They have new aims where it'll now be a 20% reduction from that 2014 baseline in all-cause healthcare-acquired conditions, and a 12% reduction in 30-day readmissions. Charters for Hinn will be sent out prior to award, so we will be sending those out to your hospital CEOs today or tomorrow. I will also be sending them out to the quality folks so they know that those are coming. The draft measure release will hopefully be sent out the beginning of this week, if not by the beginning of this week, sometime this week. On Friday during our office hours Zoom, we are going to be looking at the draft measures and talking about them. Toolkit release most likely will be sometime next week on or around the 26th. And it will be very similar to our current toolkit. We are going to add, enhance it, make it a little bit more user-friendly. So there's some additional information built in there based on the frequently asked questions that we've had throughout this last year. With the Hinn, the majority of our events will be virtual. The first virtual learning community being the first week of December. Our one in-person learning community will be in September of 2017. So there will be more information about the virtual events that will be coming up. We will again hold on-site regional meetings again this year. We had a lot of great feedback about those regional meetings. Everybody really enjoyed those. So we will do regional meetings again this next year. Any questions about Hinn 2.0 or Hinn? Okay, I will hand it over to Nancy for an IEP Age update.
And I don't have a whole lot to add on, but there's the fall updates are coming up in October. If you haven't gotten your registration in, there's still time to do that. The other thing I wanted to point out is that there is a webinar coming up on Wednesday, October 5th on the new NHSN updated the baseline. So I just wanted to make sure that you had an opportunity to hear that, because I do think that that could have an impact on how your reports look and how, so I think it's going to be helpful if you sign on to that and get a feel for how that's going to impact your facility and your reporting structure. So if you didn't get that registration notice, give me a call or send me an email and I can send that to you. And other than that, we're still going with Zika and trying to get some things done here. So as soon as we have more, we'll get you more information out. That's all.
And then Cheryl is not with us today, but I have Carrie here.
Hi, can you hear me?
Yep, we can hear you.
Okay, I just have a few things to report for Telogen. We do have some new work around antibiotic stewardship. We'll be recruiting some outpatient settings on implementing the CDC core elements for antibiotic stewardship. And I also want to report, as of October 1st, the new Hinns will be assuming the work that the QIOs have been conducting with the hospitals to reduce HAIs, and that we have developed a plan for making a smooth transition from Quinn QIO HAI initiative to the Hinn HAI activities, and we will be sharing more details about this transition with our participating providers in the next coming weeks. And that's all I have. Thanks, Jennifer.
Thanks, Carrie. Any other questions for Nancy or Carrie? Okay, I am going to open up the call here. I'm going to unmute everybody's line and open it up for open discussion. If anybody has any questions or comments about any of the discussion today or any other topics.
Maybe it's Ben, maybe if she gets back, Karen, maybe she'll ask other people to figure out.
All right. Our next call is on October 10th. We'll be doing part 2 of C. diff and antimicrobial stewardship and talking more about building an antimicrobial stewardship program within your organization. Again, our Friday office hours on Zoom is every Friday at noon. Everybody, quality IP, everybody's invited. So if you have questions or certain topics that you would like covered on those Friday office hours, please email myself or Jennifer Kriegmer and let us know what your questions are, or please feel free to post them on the Hinn Hub. Upcoming topics for Zoom will be this Friday. We're going to talk about the draft measures. And then every Friday in October, we're going to dedicate that to data. So talking about NHSN reporting, onboarding for the Hinn, measurement, reporting, so they'll be very data focused. So again, if you have certain questions about measurement, reporting, NHSN, please shoot me an email and or give me a call, and we'll be sure that we cover those topics on the Friday Zooms. Thank you, everybody, for joining us today, and we'll talk to you all in October. Thank you.
This is Linda. Just a second here. I'm coming off the webinar. Do you want to leave this event? No, just let me. They're just done, and so I'm just getting it off my computer.